Thank you, team, for a great session on the management. And we will continue the session now with our guest, Dr. Safiya Karim. She's the medical lead for a new program led at the TBCC in Integrative Oncology. And she's given some of our time, and she's now double dipping in conferences with this virtual forum as well as a residency retreat. Safiya, it's over to you.
Thank you, Willem, and thank you to the organizers for inviting me to speak here, and thank you for the patients for showing up. So next slide, please. So my talk is going to be on integrative oncology, which may not be a term that you may have heard before, but let's start with a few definitions of terms that you might have heard before. So complementary therapies are considered interventions, products, and procedures that are not traditionally part of conventional medical care, but are typically used alongside conventional cancer treatment. So those conventional cancer treatments that Dr. Nixon, Dr. Henning, and Dr. Ko and Dr. Logie have just spoken to you about. On the other hand, alternative therapies are interventions that are chosen instead of conventional cancer care. They are not usually based on evidence, so kind of those clinical trials that Dr. Nixon talked about and the different stages of clinical trials. Sometimes they can be very expensive, and sometimes they can require travel to other countries that they don't, that have access to these. They are typically not part of kind of standard oncology care. So we know that complementary therapy use amongst cancer patients is quite high. And a study done in 2012 across 18 countries shows that about 46% of patients with cancer use some form of complementary therapy. And those numbers are quite similar in Canada, where they're about 48%. A survey was done in cancer patients at Tom-Baker in 2012, showed that about 47% of all patients are using some form of complementary therapies. And the predictors, so those patients who are more likely to use a complementary therapy, are patients who are female, those who are younger, those who have higher education, and a longer time since their diagnosis. I would also add that we know that, in particular, breast cancer patients are very keen on using complementary therapies and are probably one of the biggest groups to use it. In terms of, Willem, just go back one slide. In terms of complementary therapies, we think about natural health products as one category of complementary therapies, and that's what the majority of people are using. And when you ask them the reason that they're using complementary therapies, people will say, we're using it to improve quality of life, improve our immune system, increase hopefulness, but 21% actually think that some form of complementary therapy will actually cure their cancer. Next slide, please. And we know that healthcare provider communication about complementary therapy use is not optimal. So only about 40% of oncologists discussed herbs and supplement use with their patients, and only 1 in 3 oncologists felt comfortable advising their patients on the use of these therapies. Similarly, a survey at Tom-Baker, again, close to 2012, showed about 80% of providers in our institution actually had limited knowledge of complementary therapies and the evidence for their use. Next slide, please. So to me, this is, a little bit of a challenge because we have, about 50% of patients who are using some form of complementary or perhaps even alternative medicine, in their treatment. And some of them are getting information about the benefits of these treatments, and some of them are getting advice from family and friends, and not necessarily on things that are evidence-based. And, the motivation for patients, of course, is they wish to regain their control over their cancer. They want to implement strategies that may help them. They want to, take that control back versus, just leaving it up to their oncologist to tell them what drug treatments might be beneficial. And on the other side, just advance the slide, thank you. The lack of communications with the healthcare providers is a serious problem as well, because, a lot of the time oncologists and conventional providers don't know the evidence for various therapies. And sometimes providers, will say, well, don't use any form of complementary medicine or herbs or supplements while you're on my conventional treatment. because they're concerned. They're concerned that they don't want things to interfere with the effectiveness of their treatment. They want to avoid harm. So sometimes there are interactions between, a herbal supplement that you wish to take and the chemotherapy or radiation, and we'd want to avoid that. And certainly there have been cases of quite severe side effects, such as, liver failure or kidney failure. And we also want to avoid financial toxicity to patients. So, a traditional clinical trial has gone through various phases that will ensure that things work for the patients, and they have rigorous methodology. And some of the complementary therapies might not have that type of evidence, and some of them cost quite a bit of money. And in my own practice, I've seen patients, spend thousands and thousands of dollars on treatments that, may not be effective. And I think that is a concern that we should all consider. So new slide. So in recent years, there's been a kind of a more comprehensive term, which is called integrative oncology. And the definition of integrative oncology is that it's a patient-centered, evidence-informed field of cancer care that utilizes mind-body practices, natural products, and/or lifestyle modifications alongside conventional cancer treatments. And just advance, thank you. And really the goal of this is to optimize health, quality of life, and clinical outcomes across the cancer care continuum, and to empower people to prevent cancer and become active participants in their cancer treatment. Next slide. So this is a schematic of kind of what integrative oncology really represents. So under A, you can see that these are kind of the three major categories that we think about in integrative oncology. So lifestyle modifications like diet and exercise, mind-body practices such as mindfulness, meditation, yoga, tai chi, and then natural products, which include herbs and supplements. And we combine that with, patients' values, preferences, and their rights, the research evidence that may exist in these, in these kind of areas, and then as well as our clinical experience. Next slide, please. So again, these are kind of the categories of complementary therapies, which I've touched on. And I just want to emphasize that lifestyle modifications is really what we consider the foundations of wellness. So that's kind of where we start, and then we can add on from there with the different other categories. So I want to highlight the Society for Integrative Oncology. So this is really the premier institution and organization for integrative oncology across the world, really. It was founded in 2003, and their mission is to advance evidence-based, comprehensive, integrative healthcare to improve the lives of people affected by cancer. They are committed to rigorous scientific research and to evidence-informed practice. And I would invite you to go to the Society of Integrative Oncology website. It's an excellent resource for both providers and patients on what integrative oncology modalities are really, beneficial for patients. It's got a great knowledge resource section. And we're fortunate that the current president of the Society for Integrative Oncology is our very own Linda Carlson, who is part of the Department of Psychosocial Oncology here. So we have a great resource. Next slide, please. And one thing I want to highlight is that recently, the American Society of Clinical Oncology, which is really the premier institution for clinicians, which published guidelines on kind of the treatment of different oncology conditions, have endorsed the Society of Integrative Oncology clinical practice guideline for integrative therapies during and after breast cancer treatment. I think this is a huge kind of advance for the integrative oncology field, because it used to be very separate. We would talk about conventional treatment, and then kind of complementary treatment would kind of be, a second thought. And now that it's, this guideline has been actually endorsed by the American Society of Clinical Oncology, I think we can actually make good strides into kind of collecting more evidence on this. So I'll just go through this briefly, and so you can advance to the next slide. But basically, there are some grading systems as to how these guidelines were kind of developed. And so they looked at the evidence, and a grade A recommendation is something that we should highly recommend, that it's got good evidence. And then on the other side, a grade D or I recommendation is something that we shouldn't recommend, or something that has insufficient evidence. So these are just a few of the recommendations here. So I'll just kind of highlight a few of them, but I don't have time to go into all of them. But this is available on the Society of Integrative Oncology website as well for you all to kind of refer to. So thinking about radiation skin reactions, people used to think aloe vera and hyaluronic acid cream, might be beneficial, but lots of evidence has shown that this is not beneficial and should not be recommended. On the other hand, in terms of anxiety and stress reduction, things like meditation is recommended. Music therapy can also be recommended, stress management, as well as yoga. And then in terms of chemotherapy-induced nausea and vomiting, electroacupuncture could be used, or acupressure, but glutamine has been studied and does not improve nausea and vomiting during chemotherapy. And I'll just kind of skip through the next couple of slides, but again, these guidelines are available for you all to read. So next slide, and then next slide. And again, kind of, looking on kind of the ASCO recommendation and their endorsement, this is actually a announcement that happened a couple of years ago in November that said that ASCO and the Society of Integrative Oncology are going to produce 3 new guidelines together. And so it's going to be a more comprehensive, more patient-centered guidelines on pain management, fatigue in cancer survivors, and care of anxiety and depressive symptoms experienced by those with cancer. So again, I think this is, really important and huge kind of leaps and bounds in terms of really treating cancer patients as a whole person. Next slide, please. These are just some of the quotes from that headline that was distributed about the guidelines being produced. So it's really important to separate evidence-based integrative health approaches from those without evidence. And these guidelines will help the community ensure safe, effective use of integrative approaches. Many patients already use integrative approaches, but medical decisions need to be made based on firm science, just like, all of those conventional treatments that we have shown you are really based on kind of firm science. Next slide, please. So in summary, integrative oncology is a patient-centered, evidence-informed field of cancer care that utilizes complementary approaches alongside conventional cancer treatments. The Society of Integrative Oncology's mission is to advance evidence-based, comprehensive, and integrative healthcare to improve the lives of patients affected by cancer. And this is an excellent resource for both patients and healthcare providers. Guidelines exist now for evidence-based integrative modalities during and after breast cancer treatment. So please talk to your oncologist about these. And collaboration between the SIO and ASCO will really help equip the oncology community with essential knowledge needed to inform integrative therapy approaches. And then last slide, I'll just put in a little plug for our program that we are hoping to start in the next few months, which is an integrative oncology clinic or consultation service, where we would offer a one-on-one consultation with a medical oncologist, myself, who has had some additional training in integrative oncology. And the objectives of this program would be to provide patients with a patient-centered, safe, culturally sensitive, and evidence-based integrative oncology plan. We want to promote quality and safety in the use of complementary therapies, and we want to evaluate whether this type of model is feasible, whether it's effective, and whether we can kind of sustain it in the long term. So that's the end of my section. Thank you very much again for the invite.